Sorry.
Too bad.
I got this call.
Dick,
I don't
how
know
long
if it was
since
from
you
this
chaired a
person or
meeting?
Another one.
Yeah.
Well, Dickie's going to be the chair. You know we're going to get out of here in 30 minutes.
Yeah?
Oh,
I don't know, I've got about
that's right,
a
it's
10-minute report.
Yeah, he's right
Oh, boy.
here.
Oh. I see
9
all the
o'clock tonight,
scribbles.
we'll be
Yeah,
trying to get out of here.
COA.
See all the scribbles.
COA.
Nine. I was thinking.
That's early.
I was thinking 8:15.
Been anything since,
You must be Brian.
I don't go to all the, everybody's meetings.
I'm Dave. Right.
Okay, 1 minute.
No, it's just
Yeah, I
quiet
told
right
you 2
now.
minutes and then everything
Just
gets
before
quiet.
it's time.
I always tell everybody we go to the green room, come out, we're all powdered up.
Gotta tell that.
No, it's good.
Now they're getting noisy.
I always tell
Shut
everybody
down.
we go to the
Yeah.
green room, get all powdered up, and hair just perfect and
You
everything.
didn't bring a ham.
I try.
Trying to get all my.
Many were used.
I try.
Used to-
As a matter of fact, I got a call a couple days ago saying they saw one of my previous meetings and they said, you know, you look like you've been in a windstorm. It was that real windy day.
Oh, yeah. You probably came in the room here and your hair was like.
Walking down Front Street today, there's still sand on the beaches and on.
Really?
Okay,
on that property.
it's 7 o'clock,
Talking
Yes,
weather
sir.
here.
November 7th. This is the public's health and safety meeting. You rise for the pledge, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Would you call the roll, please?
Commissioner Max Bauer,
Here.
Bless you.
Coughing.
Richardson,
Here.
Lemkool,
Here.
Henschel,
Yes.
Inman,
Here.
Gilman,
Here.
Chairman Thomas.
You need some water?
No, I'm
And
fine.
Mr. Wheelock
No, water won't help.
had a poor excuse for not being here. He had a shoulder operation this afternoon, so I don't know
Slacker.
why he couldn't show up. And Mr. Fleece has a family medical problem, so they're both excused.
Yep.
How about those meetings minutes from
Uh,
October 3rd? Is there
Mr.
any
Chairman, I'll make a motion.
changes?
I'll make a motion to approve the October 3rd regular session minutes.
Second. Moved and supported, no changes, right? All in favor of the motion?
Aye.
Opposed? Minutes stand approved as read. First public comment. Would you read the rules, please?
Any person shall be permitted to address a meeting of the Board of Commissioners which is required to be open to the public under the provision of the Michigan Open Meetings Act. Public comment should be carried out in accordance with the following board rules and procedures. Any person wishing to address the board shall state his or her name and address. No person shall be allowed to speak more than once in the same matter, excluding time needed to answer commissioners' questions, if any. The chairperson shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. The chairperson may, at his or her discretion, extend the amount of time any person is allowed to speak. Public comment will be solicited during the 2 public comment periods noted in Rule 5.4 Order of Business. However, public comment will generally be received at any time during the meeting regarding a specific topic currently under discussion by the board. Members of the public wishing to comment should raise their hand or pass a note to the clerk in order to be recognized and shall not address the board until called upon by the chairperson.
Having heard all that, is there anybody who wants to speak? Thank you. Close public comment. Approval of agenda.
Move for approval.
Is there anything you'd like to add, Mr. Benda?
No, Mr. Chairman.
There's
Okay.
2 items on our,
Those
That's just
are going to be under my
information
update.
That's just information only.
Second.
okay.
Yeah.
Henschel?
Yep. Richardson Henschel. Yeah. Okay, all in favor of the motion?
Aye.
Opposed, the same? The agenda is approved. Would you read the consent calendar, please?
No special orders?
Special order.
We have a tax man here.
That's right.
We have to pay attention to the IRS.
Yes. He's here to help us.
He's from the government, he's here to help us.
I didn't have my glasses on, I was just going in the blur. Mr. Solomon?
Yes,
Would you like to speak to us?
I would.
Have at her.
You need to come up to the microphone
And introduce yourself.
and introduce yourself, yes.
My name is, sit down and everything too. My name is Brian Solomon, and I'm with the Internal Revenue Service here in Traverse City.
Welcome.
I don't work in enforcement anymore, so you don't have to hide your name tag.
Thank you.
Anything like that. Yeah. I work for Stakeholder Partnerships, Education, and Communication. That's the division that I work for. So, in a nutshell, I'm responsible for the oversight and administration of the VITA program. And I'm not even sure if anybody's heard of that. It's the Voluntary Income Tax Assistance Program.
Oh.
And they're all over, they're in every county. And I partner with nonprofits, local governments, and other organizations that kind of share the same target market that I do. And so we serve, I provide the framework and the program and the oversight for partners to train in tax law and provide this free service to community people who qualify. Now, I'm not trying to get the county to do that. It's a pretty taxing program, no pun intended. But it's pretty labor intensive. What I am trying to do is create some sort of a partnership with the county, with Grand Traverse County. There is a need here. I have all kinds of supporting data that I can provide after the meeting if it's of any interest. What I'm looking for, what I'm hoping for is maybe to put a link on the website, on Grand Traverse County's website during the filing season. And the link this is a new service that we offer this year. The link would allow for anyone in the community who makes less than $57,000 a year to file and prepare their federal and state tax return free of charge and no fee to e-file it either.
Wow.
So it's not, it's popular now to ask questions where does the money come from for these programs? Is this another wasted government program? So on and so forth. But the majority of the money for this specific program, this link that I'm offering to the county for our community, is mostly paid for by the Walmart Foundation and H&R Block. So, and so that's what I came to offer and let you all know. And if there's a certain person that I could maybe follow up with, or I can provide the data that I was talking about to Ms. Kramer, who I've talked to several times. So, can I answer any questions?
Did I hear you say that income tax is voluntary? It's a voluntary income tax program.
Where would you be located? Do you have an office already?
I do. We're across from Sam's Club, up between Hartman Road and
Where the
Division.
sleep center is.
Yeah, where the sleep center is, and
okay.
I think Ameritech used to be up there as well.
So you're just looking for us to be kind of an information source for people that are looking at government sites or whatever.
I would actually love for you to take this link and put it on your website during the filing season. Ultimately, I mean that's what I would really, and to let the county know that this is available to people that need help. The low to moderate income people. And I'm not trying to take business away from CPAs or local business people, but there's a need for it. 14,000 people in Grand Traverse County in 2010 went to the store and bought software off the shelf, and some of those people can't afford it, and they're hoping for their earned income tax credit, their tax refund. They rely on that money to pay their bills, to fix their car, to take care of business. So.
I think the Commission on Aging, doesn't they provide that service for
They do.
seniors?
They're a partner of mine.
They are your partner.
Yes.
So would it go on their website too? Is that what you'd be looking for?
I'm after the county. I mean, like Grand Traverse County.
The Commission on Aging is part of the county,
Right.
so.
But wherever you'd like to place that, if you decide to take me up on this, whatever makes the most sense for you, and however that would, work best for you, I would just be happy to partner with you in any way.
I think, personally, I think we should have him connect with Dave and the IT department and figure out what the process and whether or not it's feasible and whether, does this open the door for other organizations that we have to look at to be able to do that same thing too?
That's a good question, but
I just don't know how far this goes when you start doing that. So, and I would expect that maybe you and your staff would look at that and find out and then maybe report back to us. I'll make that motion.
Well,
I'm not saying
guess-
doing it, I'm saying,
have him come back and just research and see.
yeah, right.
Well, I'll second it for the purposes of discussion. And then I have a question.
Okay.
Have you done, it would be, I think it would be appropriate for you to contact the city of Traverse City, because I'm sure because we're in the same building, and we share a lot of resources in IT, stuff like that.
Okay.
And do you have any other cities and counties that your program has already established some kind of informational link?
This is brand new this year.
Brand new this year.
As far as this link being available to put out. And in addition to the link, anybody who's using that will have access to an IRS certified volunteer to help them through the process of preparing their return if they need help. But this program, as far as the link is concerned, is new for this year. If you'd like a list of counties or local
I was just curious
governments.
if anybody else has already been doing this.
Sure, that are participating with the full-blown program, I can provide that to you.
Herb, would you like to state your motion so that she can,
My motion is that he gets in touch with Dave Benda and the IT department. They research this and find out, and then they report back to us as to what they're finding before we make a vote.
Doug,
Yes.
Dave?
Yeah, I guess I just wanted to know where the link went and how that process worked. After someone from the public clicks on this link,
The link would take them to myfreetaxes.com, but the link would be specialized. Each link that I put out has a site ID number embedded in it, so it's not just myfreetaxes.com. That's all they'll see, but there's a special number embedded in that so that I can keep track of how many returns are done at each link, at each site, at each everything that's out there. So it would take them to myfreetaxes.com, which they're going to see the Walmart Foundation, and it's basically what it is. It's H&R Block's software, and again, it's free to anybody whose return is going to be less than $57,000 for their federal and state return.
okay.
Yes.
My sister lives in Florida. She only files federal. I live in Michigan. I file federal and state. So this will help people through federal and state?
Yes, ma'am.
Okay.
Anyone else?
Just one quick question. Just as getting back to your comment about are we opening Pandora's box or not, I guess the only thing that I would come back to is if this is an actual government type of program or product that the public can take advantage of, then I would feel more comfortable putting it on our website. And I wouldn't feel comfortable about having the public or regular businesses being able, like we got back in this previous discussion, about just being able to put ads on our website. But if this is an actual government program that would assist our public that we represent, then I'd have more of a comfort level in allowing it to happen.
And let me answer that for you. This is an Internal Revenue Service initiative.
Okay.
This is an official business. I'm not here for any other reason, but this is my job.
Okay.
This is what I do.
Fair enough.
Rob?
What if the person makes over $57,000 a year? Can they still use your program?
They can still use it, but they'll be charged at the end of it to e-file the return.
And where does that money go? Does that go to H&R Block? Or
Yeah,
is that-
they'll just be paying like a normal paying customer.
Okay, so this is actually a commercial endeavor for H&R Block?
No, this is their nonprofit. This is their. I'm at a loss for word here.
501c3?
No, it's not nonprofit. This is their community outreach. This is what they do. This is not for them to get business. And when people run into, it happens throughout the filing season with our other programs. People get to the end of their return and they thought they had enough deductions, or they thought they would qualify to get to the end of it, and they don't. So they have a choice to either pay for it or take their stuff and leave and go have it done by a pay preparer. So,
And they pay how much?
I don't know this year, but it's from year to year it changes. I think last year it was maybe $15 for federal and $15 for state or something like that.
And where did the $15 go to? Who are they paying it to?
For this product, I'd have to get back to you. So.
Good to Bob? Okay. Any more questions? Okay. Back to the motion. All in favor of the motion?
Aye.
Opposed, same? Motion passes. Thank you, Mr.
Thank
Sullivan.
you. Thanks for your time, I appreciate it.
Can we have the consent calendar?
Yes.
Okay.
You're allowed.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed therefrom and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file or approval, is approved by a single committee action adopting the consent calendar. Receive and file Community Corrections Monthly Report for September, Commission on Aging Report, the Commission on Aging Community Relations Committee Minutes of October 17, 2012, Veteran Services Monthly Report for September. For approval, Veterans Affairs, Acceptance of Donation, Grand Traverse Sheriff's Office Surplus Items, Health Department Dental Services Agreement Amendment Number 15, Health Department Medical Directive Services Agreement with Benzie Leelanau Renewal, Health Department Traverse Health Clinic Coalition Services Agreement Renewal, Animal Control Division Shelter Cleaning Agreement Renewal, and Grand Traverse County Final 911 Service Plan.
Is there anybody in the public that would like anything removed from the consent calendar? How about the board? Ross?
B5,
Page 43. Any others?
Just a quick question, if you don't mind, the administrator, rather than pulling it. On the animal control cleaning agreement, does that, is that something that that you want to put in place so the officers don't have to go over there and clean the shelters?
This is an existing agreement.
This is an existing agreement.
And it renews the existing agreement, and I think there's a 5-day out clause on this. So we have 5 days
So does
to
this-
notify this vendor that,
By virtue of doing this, does that free those officers up?
No, this is
does
done on
not.
weekends.
Not
This
yet.
is weekends.
Oh, this is just weekends? All right, I'm following. All right, okay. I'm
You want
fine.
to take it off?
No.
Okay. What's that? Have we got a motion yet? No.
I'll make a motion to approve the consent calendar with the exception of item B5.
Support.
Okay. A roll call vote.
Rob, were you the second on that? Or was that
I
Herb?
did.
Herb was.
Herb.
Okay. Commissioner Richardson,
yes.
Lemkool,
Yes.
Henschel,
Yes.
Inman,
Yes.
Gilman,
Yes.
Axbauer,
Yes.
Yes.
Chairman Towns, yes. Thank you.
Thank you. Now, the items removed. Item B5.
Yeah.
Mr. Rich Ross.
Yeah, I was just looking for a little clarification on this, because it's, in reading what was given to us, it's just not clear who's providing services to whom for what, basically, so.
Jerry Pugh, Finance Director, Grand Traverse County Health Department. This arrangement started probably, 5 years ago, I think, Commissioner. There's a series of agreements that none of them are tied to each other, but this is a funding source for Traverse Health Clinic and Coalition. So what we do each year is we review our county appropriations that are included in our budget, and we identify the portion of those funds that service low-income people in our community. On a quarterly basis, the county treasurer actually sends these funds to Lansing. They're matched with federal funds through this dish capacity that Munson has. So Munson actually, in turn, receives this money. And then Munson has a contract with the Traverse Health Clinic, and they actually forward these funds back to the health clinic. And then we actually have a contractual arrangement with the healthcare, or the Traverse Health Coalition to provide services in these programs that the original county funds were intended for.
Okay, so do the clients actually go to the health clinic first, or are they going to our health department and then referred to the health clinic, depending on the program?
We provide services, routine program services in our department. It's just that this money is passed around through this process to actually provide funding to the Traverse Health Clinic. So none of these, it's kind of like a handshake agreement between all these partners, between the Healthcare Coalition, Munson Hospital, and the Health Department. And it's just a funding mechanism that was developed some years ago to provide services for this uninsured population.
Herb?
Weren't these matched with federal dollars and there's more money comes back than what we send?
Right.
And it's kind of a shell in the pea type thing, and they're moving this money from here to there, and then it matches, and then they come back to the Traverse Health Clinic and get more money to be able to provide more services for our people in the community.
Exactly. We send $1 and they get roughly $1.70 back for every dollar that we send.
Yep.
Okay, so the services are actually being provided by our health department?
No.
Correct.
I thought by the health clinic.
The money that the health clinic gets from Munson through this process, that funds that clinic.
That's right.
But our original money that the treasurer sends to Lansing to be matched with federal funds comes back to us through this contract.
All right, I'll move for approval.
I'll support.
Go? Okay. All right. Yeah, he's a big supporter tonight. Okay, all those in favor of the motion?
Aye.
Opposed, the same? Motion carries. Thank you. Next is food service proposals for the jail.
Good evening, I'm Bob Hall, I'm the jail administrator, Grand Traverse County Jail. I'm here today to discuss with you our food service proposals for providing food service to the Grand Traverse County Jail. We have a current contract with a vendor that expires at the end of the year, December 31st. The packet that you have before you discusses a little bit of the history of the food service in Grand Traverse County. We also discussed the process. We solicited proposals from 4 vendors that I had contact with over the last 3-4 years that indicated they would be interested in providing food service when our contract expired. So I sent them the proposals, the request for proposals, and we also advertised in the local paper on a weekend, on 2 days. The vendors also received current 4-week cycles of our existing menu, so they knew what type of food that we are currently using, and it's basically been the same type for years. Not steak, baked potatoes, and things like that. They also wanted a copy of the schedule that our inmate workers work in the kitchen, so they know what kind of support service they would have available to them, and they also wanted copies of the invoices so they knew exactly what we were paying for our existing food service. I listed the 4 vendors that received proposals. We had a pre-bid conference. 3 of the 4 vendors showed up at the pre-bid conference. And then on October 3rd, we received the actual proposals from all 3 of those vendors. We didn't receive any extra ones from anybody that saw the ad in the local paper. As part of the process, we establish an evaluation committee. Every time we have a contract that is up for renewal in the jail, we select a team of administration, supervisors, and deputies that are involved on a daily basis with that particular activity, and they review independently and score and evaluate the proposals. And we get back together and we compare scores and we rate the proposals. As part of the evaluation process, I listed all the different counties that we contacted. And as a result of the proposal evaluation, the team made the
some of the following determinations. All three vendors were in business for quite a period of time, significant amount of time. All the agencies that we contacted for all three vendors were extremely pleased with each of the vendors. The menus were all essentially the same, with an ounce different here and an ounce difference there. They were all pretty much the same, and they were all reviewed and prepared by registered dietitians, and they met all the requirements of the state and federal laws with regards to special medical and religious diets. They each had their own process for assuring food quality. They each had contingencies outlined in the event of an emergency, if we lost operations of the kitchen, if there were food service strikes or food supplier strikes. Each had different plans. Each plan was determined to be workable. Each offered their employees training, and it actually boiled down to the final evaluation criteria, which was cost. I gave you a vendor comparison showing all the different major categories in the areas that we evaluated. The cost was, the lowest cost was $1.34.9 per meal, and the highest cost was $1.57 per meal. On page 5 of your proposal, I gave you a cost analysis. Our capacity of our jail at full rated capacity is 194 inmates. At the time that this was sent out, we had 140 average daily population. So I calculated both where we were at that day and where we would be at maximum. We wouldn't be over capacity because state law requires us to file a series of overcrowding things which would drop us well below the capacity. So we wouldn't be at 194 more than about 5 days, and it would have to drop. I did cost comparisons showing the difference in the rates per meal, and I also extended it out if we had 194 beds, what the cost would be, 194 inmates, and I also compared it out if we had 140 inmates, what the cost would be. In reality, the cost is going to be probably somewhere in between as the jail population fluctuates throughout the next 3 years. After careful review, it was the committee's recommendation that we accept the lowest bidder on this one, which happens to be our current vendor, which is Aramark, and we are asking authorization from the board to award the 3-year food service contract to Aramark Correctional Services beginning January 1st of 2013 and ending December 31st of 2015 at the rate of $1.34.9 per meal.
Mr. Chairman, I'll make a motion to approve the recommendation for Aramark.
Anyone in Henshaw? And you're satisfied with the service? Bob,
I'm sorry?
You're satisfied with their service?
Yeah, we're very satisfied. One other point I wanted to make, the contract allows for an extension if at the end of the 3 years economics are such that it's in the county's best interest to maybe extend it for an additional year. The language is in there for us to address it at that time.
I'll support.
Rob did.
He's
Oh,
already
did
been-
he? I'm sorry, I didn't hear him.
So
All did. Herb?
they're giving this contract away, aren't they? This is lower than the last contract. Last contract, yes. All 3 vendors were lower than the last contract, so.
Yeah. And
That's
Aramark-
why we go out for bid.
Yeah, and Aramark does not have another contract in northern Michigan, correct, at this time?
I don't think there's one in northern Michigan up here, no.
Yeah.
No.
So,
Closest one is Roscommon.
That's northern.
Jails, that's
sir.
just jails.
I just wanted to commend the Sheriff's Department, Bob, you especially, for doing a really good job of really researching the topic. Make sure not only we get the best price, but great quality. So, well done. Thank you.
Thank you.
Well, I'd like to second Commissioner Henschel's comment. When I read the packet, I thought the way you presented the presentation, the history, and the analysis, and the dollar comparisons, and how you came to the recommendation, I thought the write-up was excellent.
Thank you.
Okay.
is this within your budget?
Yes.
I guess
Yes.
it would be, wouldn't it?
Well, if it hits the 194 every day, we'll probably be talking at the end of November next year.
Well,
We'd be talking earlier about other issues.
well,
All right. Any more questions? All those in favor of the motion?
Aye.
Opposed, the same? Motion carries. You're on a roll.
Nate Elger, Grand Traverse Sheriff's Office. We are here again asking for approval to engage in the Burn Justice Assistant Grant for the Traverse Narcotics Team. This is a 50% match. As noted in the item, the amount allocated by the state, which is a pass-through from the federal government, mind you, is going down and has been going down for several years. It's at the lowest it's been historically. So this year's award to us is $20,941. We have a 50% match of that, totaling $41,882.
We had, that's part of the budget, right? I mean, that was included in the budget, our matching amount for that.
Yeah, we do.
It is in the
I don't
2013.
know if it was the exact number, but
I don't know that we knew the amount in the revenue side of that, but the expense is budgeted.
I'll move to approve.
Mitchell? Who seconded? Richard. Any discussion? Seeing none, all those in favor of the motion?
Aye.
Opposed, the same. Motion carried.
Thank you.
Thank you, gentlemen.
Thank you.
Said I like you running the meetings. Wasn't right through this sucker.
I had 122 minutes. Usually they're short before the election.
Wendy
All
True.
yours.
Okay, I don't know if you had to announce the agenda item or not. Wendy True, Health Department. Just here to give for your information only on the update of the moving to the new building. We have 2 days left in our current building. Tuesday is actually move day. Wednesday will be unpacking day. Over the weekend, the IT department will be there installing phones, installing computers, printers, getting everything set. So we should technically only be offline for half a day Friday and maybe part of the day Tuesday. Kind of our goal during this whole time is to minimize the disruption of services to the public. So we're working with the media. We have a press release going out tomorrow. We'll be updating our website with contingency plans for some of the essential services. So there will be a phone number that they can call during that day and a half if it's an urgent issue that needs to be addressed, or if there's a disease outbreak or something like that that we need to respond to. We're notifying all their key partners. Facilities and IT staff have just, I can't say enough about how helpful they've been. Really need to say thank you to them. They have been putting in addition to their normal workloads, all kinds of extra time just for this building and getting it ready, and even during the move for us. So you have a great staff there. And we're also using this move as a test of our continuity of operations as part of emergency preparedness. So we're documenting everything as it comes down. One of the big things is moving the vaccine refrigerators. Those have to maintain a certain temperature. There's a kind of a narrow window. They have to be maintained at all times. So we're monitoring that. And essentially just shutting down and restarting all of our services. So, any questions at all?
Do we have an occupancy permit yet?
We should be getting temporary occupancy permits.
Danny thought it would be Tuesday morning when he
That's
talked
kind of
to...
awful close. Well, what happens if you have a punch list that's not taken care of?
They started the punch list Monday, and there's just some minor things, nothing major, nothing that would prevent us from moving, is what we've been assured.
I've been in situations where the people had the moving truck sitting outside the door, and you didn't get your occupancy permit, and you wait.
That's happened before.
Yeah, and that's why I'm just a little bit concerned about that.
We'll follow up on that with him tomorrow.
Okay?
Yeah.
Yeah, if we could get it by Friday, it'd make your job a whole lot easier.
Definitely. Yeah, and I'm sure he's pushing for that too.
Question, Mr. Chairman. Can you remind me where we're at with putting the sale of the current building on the market?
It is on the market.
It is on the market. We chose the broker, And have we gotten any activity on the building, or?
We get monthly reports on that. I can provide you with what I've received,
Okay.
the latest one I've received.
Nothing,
It's out there.
serious.
It's on many internet
right.
search engines and sites and so forth, and we
Okay.
get looks, but we haven't got any takers yet.
all right.
I went over there this last week, and I went through, and in fact, Danny gave me a tour through. Mechanically, this is a mechanically up-to-date building. This is state-of-the-art stuff, and that building is pretty nice. We made a good call on this, and the health department, I think they're going to have a really fine facility over there. The only question I have is, are you going to move the Ghost over from the old building?
No, we're leaving all the ghosts, anything bad behind, we're shutting the door.
Is there really a ghost over there?
Yeah, I could tell you the staff, as stressful as it is now, very, very excited. And I don't think public health departments normally get an opportunity like this. I mean, it's rare that public health gets a new building so we are very appreciative and very excited. Should bring a lot of, not that we're inefficient, but it should help with some clinic things, just the way it's set up.
It flows a lot better in
Yeah,
there.
yeah. Any other questions?
No. Well, it looks good.
Good job.
Thank you.
Thank you. Well,
We're getting close, Dickie.
we have no unfinished business. Do we have any new business?
No.
Mr. Benda wants to talk about that lawsuit?
Well, yeah, I just wanted to mention that we are now completely dismissed from the Knutson lawsuit. Mr. Nault from our Construction Codes Office has been exonerated, and we are now not a defendant in the case any longer, which is a good thing. That tomorrow night is a boardman...
Go ahead.
I'm sorry. Tomorrow night is a meeting, a public meeting at the Civic Center regarding the Boardman Dams project with a lot of the folks that are most intimately involved in the project to just answer questions from the public. They don't have any definitive answers on what happened, how it happened, but they do have quite a bit of information, and the public is welcome. It begins at 6 p.m. at the Civic Center.
Now, that lawsuit, that was the young fellow that got electrocuted in the...
That's
marina.
correct.
Oh, that's the deal.
Yeah.
Okay.
Okay. Time for the second public comment. Gee, they didn't even talk as much this time as last time.
The young lady from the high school she got blessed here.
Yes, you take the right meeting.
You picked the right meeting.
I tell high school kids, public health and safety is what you want to come to.
Usually we sit here till 10 o'clock. Yes, sir.
Can I readdress the board just very quick?
You come to the mic, because we're televised.
Brian Solomon, IRS again. I choked on your question, Mr. Henschel. I apologize. So I got to sit there and think for a minute. When it returns outside $57,000, it becomes outside the scope of our program. So that revenue is going to go to H&R Block or the provider of the software. That's what it's going to go to. And it becomes outside the scope of our program at that time. So I will get you the cost for the federal and state return. But I just want to reiterate that. If that happens, they're outside the scope of what we're trying to do and this national partnership that IRS has with the foundation. So thanks for the opportunity again.
Thank you.
Thank you.
Yeah.
Okay. Committee reports.
I have a long list, all stemming from Commission on Aging. First of all, I want everyone to know, and Holly is here to answer any questions if you have them. The Commission on Aging did go out for home chore bids. The bids, the lowest bid came back at approximately $146,000. We can provide that service in-house for $108,000.
Wow.
So the county employees are a better bang for the buck. So the Commission on Aging yesterday voted unanimously, obviously not to accept the bid and continue our in-home service.
Good.
We, turkey dinner at the senior center. This is our first. It is, I know Herb, you're planning on going, you and
Barbara and I are
Barb.
both going to be there.
It's obviously November 22nd, which is Thanksgiving. A Thanksgiving dinner would be on Thanksgiving. It's at 1 o'clock. It's fully catered. Bob Evans is doing the catering. It's $10 a ticket. Ticket sales are from now until November 16th. You must be a Senior Center Network member or guest of a member, and I would remind everybody in Grand Traverse County that membership is free if you are a senior. The other thing I wanted to mention is Baskets of Bounty. As you all know, every year the Commission on Aging collects non-perishable food items, toiletry items, laundry, soap, paper goods, etc., and we provide Baskets of Bounty to low-income seniors in Grand Traverse County. So donations are being accepted, donations of those types of goods, as well as monetary donations at our Commission on Aging office, and for anyone who's listening, that's at 520 West Front Street here in Traverse City. If you have any questions, you can call the Commission on Aging office at 922-4688. And let's see. Oh, the foot care clinics. As you all know, the Commission on Aging Board voted, and this board supported eliminating foot care clinics. Those clinics are going to be continued with a private vendor. Comfort Keepers is going to begin foot care clinics after the first of the year. So that service will continue. And Holly, have I forgotten anything?
Okay.
All right, thank you.
You know, you said non-perishable foods?
Yes.
Okay, now, if they want to come out to my house and eat, they can have non-edible food.
You want to give your address? Oh,
You're cooking for yourself, huh?
and, you know, as we go out to our townships, really, if you know of low-income seniors, and this is a program for low-income seniors who might otherwise not get a Christmas, you know, please call the Commission on Aging office and let us know.
For Thanksgiving dinner, is there going to be transportation available for those that don't have transportation ability?
Well, as luck would have it, Commission on Aging has a transportation program. So in that respect.
I just didn't know if there was going to be any particular...
No, there isn't. Not to my knowledge.
So it may be one of those things you may want to look at, because some of those people that can't afford to get there don't have cars and would like to come in and be able to have the socialization.
They can call the Commission on Aging office. We have beta passes, and we have taxi coupons available, so.
Anybody else? I have one announcement. Anybody wants to have a lot of fun, the BPW is meeting in the morning at 9 o'clock at Garfield.
Oh.
Okay.
So,
Yep.
I'll probably be here. And we have the open house for the health department.
That's in December.
I've got one other item. I'm sorry. Again, it's with Commission on Aging. I made my notes, but I scribbled. Jim Pasco is this county board's representative on the Area Agency on Aging Board. Jim is willing to serve until the end of the year. We will need to address that next year. So I will bring that up at Commission on Aging after the first of the year when we have our new board members. We've had 2 resignations and 2 members have asked not to be reappointed. So we do have 2 openings, and by the way, we do have some people who are interested, maybe interested in applying. So we're out reaching.
Okay.
My question is do we want to appoint somebody, or is this a good time to be able to look at downsizing their board?
This is just a suggestion, but please, before you do anything like downsizing the board, would you please run it by the Commission on Aging Board
I would hope that they would look at it and come back with a recommendation quickly.
Right now, the inclination is leave it alone. It works fine, in their opinion.
It's an awful big board.
Yeah, but our meetings never last as long as these meetings do. We're done in an hour.
So if you get the people wanting to come in and do it, you know.
And, you stop and think about this. We work, those board members, we work for those millages.
Right.
When you're reaching out into the community that
More the
way,
better.
you need to reach out into the community. And as most of us know, passing a millage is not necessarily easy. Ask TCAPs. So,
Well, I just talked to a lot of people, and they all think that 15 members on a board is too large. So,
have you asked the Commission on Aging Board? Come on,
I got one
Come
member
on
of the Commission
over.
on Aging who said that's also...
one member is not,
I know. I'm
The board.
comfortable.
I
I'm comfortable.
just soon leave them alone if that's what they want to do.
well, we haven't discussed it yet, but we're going to have
Would
the
you please?
discussion. Yes, but in
Yes.
the meantime, we've got 2 openings.
Yeah.
Okay, all right, good.
All right?
Very good.
Is there any need to go into a closed session? How about a motion to adjourn?
So be it.
Move to adjourn.
And remember, the 2 guys that are missing tonight, and it usually takes us 3 hours.
All right.
Meeting adjourned.
We stand adjourned, Mr.
Generally, each one of us goes to anywhere from 6 to 10 other meetings besides. It takes quite a
I
bit
think
of
they're
time.
working both cases simultaneously.
When are you going to run?
With the same
When are you
judge.
going to run for it?
For Nault to be dismissed from both of those cases. Because he really did it for 34 years.
Our inspector?
In the short time that I spent there,